everyone, Assalamu alaikum and good evening. This is Dr. Tazeen, one of the mentors at StudyMEDIC and StudyMEDIC, and we are here with YouTube series for all EFOG OSCE aspirants who are going to take their exams in December 2025. We are going to cover one important task in this session, which is about breaking bad news. I will be the exam going candidate, and with me has joined Dr. Priya Darshini, who is course director for EFOG, and she will be the role player as well as examiner in this task. Hello, Dr. Priya.
Hello, Dr. Tazeen.
All right, so we shall start this session, and first of all, these are the candidate instructions. Meanwhile, if you have not subscribed the YouTube channel of StudyMEDIC, subscribe now and just click on the bell icon and go through these EFOG free YouTube series, which are basically designed for all OSCE going candidates. All right, we can start. Hello, this is Dr. Tazeen, one of the exam going candidates. I have read the instructions and I'm ready for the task. Hello, this is Dr. Tazeen, one of the doctors in the clinic. Am I talking to Sarah, 34 years of age?
Yeah, hi, Doctor. Yes, I'm Sarah.
All right, Sarah, I can understand that you missed your periods and a few investigations were carried out, and you are here to discuss the results. Is that correct?
Yeah, yes, Doctor. Absolutely, you're right. I'm really worried of what's happening with me, Doctor.
All right, don't worry, we are here to help and support you. Apart from this, Sarah, do you have any other concerns or expectations from this consultation?
No, Doctor. I'm just looking forward to, have my baby soon. I want to start my family, and I'm really worried, Doctor. I just hope you'll be able to help me with that.
Yes, sure, Sarah. We are here to help you, and I can totally understand your concerns. I know you have been waiting for your test results, and I want you to know that we all are here to help you, guide you, and support you throughout the process. So, before
That's
moving
really
forward,
supportive, Doctor. I appreciate you for this.
yes, sure, Sarah. So, tell me, how are you feeling today?
Well, I'm a bit anxious, doctor. I'm really worried of, I know that periods are very important for every woman and not having periods for 6 months. And, I'm also planning a baby. I'm really, really anxious, doctor, today.
Your concerns are really valid, Sarah, and I can see that you are here alone. Do you want someone to be with you as I have a lot of information to give you?
Oh, well, doctor, I just wish I could have my husband, but he's out at work. So that's okay, doctor. Thank you for asking.
That's totally understandable, Sarah. So, Sarah, what I will do is that first I will discuss the test results with you. Then I may need to ask you a few questions to know more about you, and then I will discuss the options with you. How does that sound, Sarah?
Yeah, doctor, this sounds perfect for me. Please go ahead.
All right, Sarah. So, as I discussed, that few of the test results were carried out, as you know, and you are here to discuss the results. I'm extremely sorry that I don't have a very pleasant news to discuss with you.
Oh
Uh,
my God, doctor. I'm really scared.
yes, Sarah. I have checked your name and your hospital registration number on your test results, and these
Okay.
reports belong to you. So,
Okay,
Sarah, these
doctor.
test results suggest that your ovaries they have stopped working earlier than normal, which is a condition which we call as premature ovarian insufficiency. Have you ever heard about that, Sarah?
No, doctor. What does this mean to me, doctor? I'm just listening this for the first time. What has happened with me, doctor?
I can totally understand, Sarah. This is a lot to take, and I will explain everything with you that what actually premature ovarian insufficiency is, and I will discuss all your concerns with you as well, and we will reach a further plan with you, and I will also involve my consultant. Would that be okay if I ask you a few quick questions to know more about you?
Okay, doctor. Please ask, doctor, what should I do?
So, Sarah, tell me that since how long you were having irregularity or missing the periods?
It was there for almost last 2 years, doctor. I used to miss my period by a month or two, and then I thought, okay, maybe because of stress, all this is happening. I didn't mind a lot about it. But for
All
the
right.
past 6 months, I just didn't get my periods.
Mm-hmm. I can understand. And before that, the cycle was regular otherwise?
Uh, no, doctor, it is quite irregular.
Mm-hmm. And Sarah, when you started missing the periods, were there any unusual symptoms like hot flashes or low mood, which you observed?
Yes, doctor. I used to be very anxious about my sexual life also. There used to be a bit of vaginal dryness, and I never had a sexual desire also. But then, yeah, I never had hot flashes as such.
All right. And did you consulted or took any medicines at that time?
No, doctor, not really. I just used to, Google my symptoms, and that's it. Nothing much, doctor.
All right. Sarah, few questions may feel intrusive or personal. Are you in a stable relationship?
Yeah, yes, doctor, I am in. For the past 3 years, we've been living together, and we just got married a year back. And now we are all ready to start the family.
All right. And I'm so sorry to ask you that you have, I can understand from your notes that you have never been pregnant before. Is that correct?
Yeah, I've never been pregnant, doctor. I'm just looking forward for my pregnancy.
I can understand. Are you updated with your smears?
Yeah, I am.
Any other medical concern you want to share with me?
No, doctor, nothing. I've generally been fine except for this period issue.
Any medications you used previously?
No, doctor, nothing, nothing. I was
Any
using before.
allergies?
No, doctor, nothing.
Any surgeries
Can
in
you
the
just tell me what does this mean to me, doctor? Apart from this one issue, I've never been visiting any GP or any doctor.
Sarah, do you
Will I
smoke
have
or
my
take
baby,
alcohol?
doctor? No, doctor, never.
All
Never.
right.
I've used any of
And
them.
are you aware of your height to weight ratio?
Yes, doctor, I'm 22.
Sarah, is there anyone in the family who had the same situation, like having
Never,
missing
doctor.
periods earlier?
I'm the first one facing all of this, and I'm really worried. Why is all this happening with
All
me?
right,
I
Sarah,
want
thank
to
you
have
so
my baby,
much.
doctor. I just
Yeah,
want to have my baby.
I totally understand your concerns, and I will come to the your. I will address your concerns, Sarah. So, Sarah, what happens in premature ovarian insufficiency is basically, as I told you, that the ovaries they stop releasing the eggs and they stop
Okay.
producing certain hormones which are very important for your fertility as well as for heart, for bones, and general health as well. So there
Mm-hmm.
can be, Sarah, many reasons of it. Like in most of the cases, the reason is not known, or there if there is family history of this problem, or if some people they have used certain medicines for this, or they are having some situations like some conditions which are running in the family, which we call as autoimmune diseases. Are you with me, Sarah?
Okay.
Sarah, so coming to your concerns, as you are quite anxious and you want to start your family as early as possible.
Yes,
In most
doctor.
of the women who have this condition, as the ovaries are no longer functioning, so the natural pregnancy can happen, but it is very unlikely. Only 1 to 5 out of 100 women they can have the release of eggs, and there are chances that they can get pregnant, but that is very unlikely in that situation, Sarah.
Okay, doctor.
But Sarah, I want to tell you that there are certain other options which can be available for the fertility, and there are good options to become mother and have your family. Can I proceed explaining those options with you, Sarah?
Yes, doctor. Please tell me.
The one is that you can have donor eggs, and we can go for in vitro fertilization, which we call as test tube babies. And we can use healthy eggs, and then we can use your partner's sperms, and this embryo can be placed in your womb. And the other option can be
That
that
means I will not have my own baby, doctor, if I have to use a donor egg.
yes, Sarah, I can understand your concerns, but as the sperms will be used from your partner, so that would be biologically similar to your partner, and then the baby can be placed in your womb, and this pregnancy can be taken care, Sarah.
Okay, doctor, I understand.
Sarah, the other option is that both the sperms and eggs can be taken from the donors and then we can proceed for test tube babies. That can be also among one of the options and it also carries a good success rate, Sarah.
Okay, doctor.
You with me, Sarah. And the third option is, Sarah, that there are many children who needs attention and care. And I can understand and I can see that both you and your partners, they can be excellent parents. So you can go for adoption and you can take care of the kids and you can adopt the babies, Sarah.
Okay, doctor.
Do you have any questions so far, Sarah?
No, doctor. I didn't expect that, I have to listen to all of this today. But I will
I
certainly think about all that you have told me, doctor.
I can understand, Sarah. This might be very difficult situation for you, and I can connect you with the counselor as well as you are very anxious, and they can talk with you. And with the talking therapy, this can help you in coping this difficult situation.
Sure, doctor. That would be really helpful.
Apart, yes, Sarah, I will connect you. And Sarah, apart from this, there are certain health concerns as the few hormones are secreted from the ovaries and they are good for your heart, for your bones, and for your general health. So we may need to start hormonal replacement therapy for you to protect your heart and to protect your bones and to improve your general health overall, Sarah.
Okay, doctor.
So do you have any questions so far, Sarah?
No, doctor. I'm just trying to digest all the information that you have given me today.
Yes, Sarah, and don't worry. We all the time we are here to support you and help you. So what I'm going to do now is that I am fixing your appointment with consultant. I will give you written information in the form of leaflets. You can go through that and you can understand better. I will also connect you with the support groups where you can meet women who have gone through same situation and how they started their families and how they improved their general health. And I will also
Okay,
connect
doctor.
you with the counselor. How does that sound, Sarah?
Yes, doctor. This is really helpful, doctor, at this moment. I will
All
certainly look into all that you have told me, doctor.
all right, Sarah. Thank you so much for coming. And before finish, I just want to reassure you that we as a team of doctors are here to help you and support you throughout this difficult time. Thank you so much,
Thank you, doctor.
Sarah. Thank
Thank
you.
you, doctor. Thank you for being so supportive.
Thank you so much. Thank you so
All
much.
right.
Yeah.
So, thank you, Dr. Tazeen. That was a wonderful presentation, I should say. At the outset, thank you for doing this YouTube series. This is really going to be helpful for all the exam going candidates because, as we know, Breaking Bad is one of the important stations for EPCOG examination. It is a definite station there, and we do have both obstetrics and gynae cases coming up here. And the topic of premature ovarian failure is quite a common one that we can expect in exams. So, at the outset, to give you an overall, marking of the station, I should say this is a clear pass. But however, if I have to break it down into the specifications, your intro was very good. Your agenda setting was good. You told who you are, what you're for, and you would ask the role player also interactions in between. You're checking for understanding of the role player throughout the station. That is a very, very good point that all candidates must see for during the exams. And then you took it very slowly. You asked for support and all that before breaking the news. You ensured that you gave adequate time for the role player to react and to accept the news. And emotional support and empathy was something that was present throughout the presentation. So that's really, really a well done point from my side. And apart from that, coming to processing the information of the report, you confirm that the report belongs to the role player. That is again a good point. And then you process the information, you gave her the warning shots, and then you slowly told her what is POF and what does it mean to her. You addressed both the general points and the fertility points, and you took it very, very slowly. And at the end, you also gave her some information leaflet so that she can come back for a follow up. So all these were must points, and everything I should say is a definite tick for you. And also for EBCOG exams, we have the marking from the role player also. So me as a role player, I was very much satisfied with your approach. You were very empathetic towards me. You were trying to listen to my concerns. You were trying to get some information out of me, which certainly will help you for a better management plan. And you dealt with me in a very, very, the professionalism was to the utmost core, I should say. So I really appreciate and all that, and I feel very comfortable having you as my doctor. So these are the comments from the role player.
All right. Thank you so much, Dr. Priya. So now we quickly go through the format that how we have to cover up this station. So this was a task where 35-year-old Nali Gravida has come to you and she is having amenorrhea for 6 months and now there is diagnosis of premature ovarian insufficiency. So the role player was Sarah, 35 years, and she's married for 4 years. She's anxious and she's hopeful that she's going to start family, but now she's missing her periods, and now the diagnosis of premature ovarian failure is there. So, what can be the prompts by the role player? The role player can be very anxious. They might be blaming themselves, or they might be anxious to know that why this has happened with them, and what about their fertility. And most of the time, they should also be informed that apart from infertility, premature ovarian insufficiency can have some long-term health consequences, which needs to be addressed as well, and
Mhm.
partners support is very very important in these tasks, so this should be dealt carefully. So, in communication, this is a task where the role player is anxious and you are breaking such a bad news to patient. So, it should be very private, supportive environment. Empathy should be there, simple language without jargons. Respond to the emotional status of the woman, that how they respond and how you have to take care. Provide hope without any false reassurance. This is premature ovarian insufficiency. We cannot reassure that there are 100% chances that she can have natural pregnancy, which is very unlikely. So, no false reassurance should be there. And any questions which are there by the role players, they should be addressed nicely. Explain what premature ovarian insufficiency is, what can be the causes, if any risk factor is there. Although in this patient there were no risk factors, but in some of the patients, there can be some certain risk factors like the use of chemotherapeutic agents, any autoimmune diseases, or family history that should be told to the patient that this can be among one of the causes of premature ovarian insufficiency. Now, when we have to deal with this patient, we have to deal fertility options as well as her general lifestyle. So that can be donor eggs and IVF, donor embryos can be there, possibility of adoption, surrogacy, and hormonal replacement therapy for general health. And then psychological support is very, very important. So counselor support should be provided to this patient. Clear explanation of the diagnosis as well as her addressing her concerns and what can be the options, and summarizing by the end that what you are going to do, and reassurance by the end in cases of breaking bad news that support is there. We as a team of doctors are there to support them and help them, and so that they feel that they are reassured in such a way that there are no concerns which cannot be addressed by the doctors. So this was all about breaking bad news about premature ovarian insufficiency, and we have to take care of all these things in other stations as well when we are dealing with such cases. Like we have to break the news for some cancers, or some anomalous baby or anything, that signposting should be there, empathy should be up to mark, and how we have to give the information in chunks, not in junks, and we have to make sure that understanding of the patient is there and proper reassurance should be there. Thank you so much for watching a YouTube channel of StudyMEDIC. And if you have not subscribe now and click on the bell icon so that you can stay updated with the upcoming sessions. Once again, thank you so much, Dr. Priyadarshini, and thank you so much, everyone. Thank you.
Thank you, Dr. Tazeen.